This is Constance. She's a patient of mine. She's been a patient for about a year. We've tapered her off her medications a little bit. She's seen other doctors where they've been giving her a lot more. She's done her exercises. She's quit smoking over the past 5 months. She actually came in here with a high blood pressure because she had an allergic reaction to shellfish, and she went to the urgent care and got it taken care of. We gave her a supplement that brings down her blood pressure. It's a natural supplement called Neo 40, and we'll take her blood pressure a little bit later on. But thank God that she's been able to overcome the worst case scenario when having an allergic reaction. She's had a lot of stresses in her life. That was a result of why her blood pressure was so high. Very tragic things have happened. I'm not going to go into that. Anyway, she's here. She presents with low back pain. This doesn't radiate to her lower extremities, and it's actually, the pain is better with standing up, which is not what usually people say, and worse when lying on her back. So on examination, I've already palpated her, and she's got a lot of specific areas where there's ligamentous tenderness on sonal palpation. So we're going to start out looking at her lower back under ultrasound. So those wonderful things that you see here, this is called the multifidus muscle. And she probably needs to do a little bit more exercise because there's these areas here are infiltrated with fat. So this doesn't mean her whole muscle is, but when there's fatty infiltration, muscles don't work as well, okay? And when I press here, I'm not going to press really hard, but I know she's tender because I've done it before. I'm pressing and she goes, ooh, that's over the sacroiliac ligament, the powerful interosseous ligaments. Now when I come over here, this is called the superior cluneal nerves. You have three little nerves that come over this little ridge here. This is called the iliac crest. They come over the ridge and they get caught in what are called osteofibrous tunnels. So she's got what's called superior cluneal nerve syndrome. This can also cause constant burning and irritation of those three nerves coming over. So we've looked at that, and now we're going to come up, and the first thing we're going to see is her L5 spinous process. I press down on this, and she hurts there. So when I press directly down on the spinous process, that means she's got a disc problem as well. So in her work, she works as a provider. She has to move a lot of people. So she's probably got some disc desiccation. I don't need an MRI. I don't need an X-ray. I know that she's probably got that just from the pressing on the disc itself. Then, as we can see here, we have, these are called the facet joints. Okay, this means that when you push on the shopping carts, you tend to lean forward, or you tend to walk straight up.
I tend to lean forward.
Okay, and why is that? Because it hurts more when you walk straight up.
Mm-hmm.
Okay, well that I expected that, and because these are facet joints, these have to do with a lot of the extension rotation, and she has what's called a positive Kemp sign, which means that she's got some facet compromise in those areas. Now when I put this here, you can see this is not a pretty back here, okay? Right there. So these are the facet joints and long axis, and we've already taken a picture of that. Now we're going to do one other thing that we can do with ultrasound. It's called a PDI. Go ahead and press the PDI. Okay, so I can see that there's, especially this L405 facet, there's a lot of degenerative changes here. In fact, there's probably some fluid in the capsule. But the thing is that what we notice here is, I'm going to try to maneuver this a little bit, and we see these red. I'm going to come this area, I'm going to come that area, bring it down a little bit, bring it down, yeah, bring it down. So you see that red area there? Those are aberrant blood vessels. That's called neovascularization. So when the body is in a degenerative process, it tries to bring blood vessels into the area for repair. Unfortunately, it doesn't repair nothing, and it releases a peptide called gene-related peptide. I don't know what the first letter is. So you see that? See that? Make a close-up of that.
Mm-hmm.
See that? Okay. No, you can use your finger.
Yeah, I did. It
No? Okay, it's close. Well, bring it up. You're not centering it. I'm trying to advise our videographer here. So why don't we go ahead and take a picture there? So this is almost, in my opinion, the closest thing to an objective presence of pain. And she does have pain there. Take a picture there, please. Take a picture. Okay, and so she has this all along the areas of the muscle. P1. It's on the L side.
So she has that. So what? And then I'm going on the other side, and these are the muscles, and you can see these areas here. Okay, take that off. Okay. So now I'm going to come to the area just below here. Right there. Yeah, she didn't like that either. Okay, so there's when on the exam she had positive ligamentous provocation. This provocation referred pain here. So these ligaments that are tied from here to areas of her spine and her butt area are also affected. So these are called the proximal origin of the sacrospinous and sacrotuberous ligaments. So this is also an area here. So as I come up here, now I bring it down, and then I know you guys probably you don't know this unless you're. This is called the sacroiliac joint. I'm going to press on there. She didn't like that either. Okay, now I go below it, and I turn, and then we see these ligaments here. Okay, so basically she's had ligamentous laxity. She would be a good candidate for prolotherapy, which is a way in which to regenerate collagen over these defective areas, or shockwave therapy, which kind of does the same thing as prolotherapy without the use of a needle to guide the dextrose for this. And she's going to continue to stop smoking. She's going to continue her exercises, and maybe we might taper down. She understands that the goal here is to be off these medications. Thank you so much, and thank you, Constance, for allowing me to tape this.